Welcome to the Checkup. I'm Modern Healthcare's managing editor, Erica Teichert. Healthcare's workforce is 75% women, according to the Bureau of Labor Statistics, but that isn't reflected in the C-suite. Approximately one-third of healthcare executives are women, and 15% of CEOs are female. While many healthcare industry members have increased their efforts towards diversity, equity, and inclusion, there are still barriers to break that could help women and people of color reach executive leadership positions. Joining us to discuss the path to leadership, as well as her work in digital health, is Ochsner Health's Chief Digital Officer, Dr. Denise Basow. Welcome to the Checkup, Denise.
Thank you. It's great to be here.
You joined Ochsner as its first Chief Digital Officer ever just at the beginning of this year. What made you decide to join the organization, and what's been your experience so far leading their digital health programs?
The experience has been great. Ochsner's a wonderful place. I thought that going in, but that's been confirmed very early on. I have a real passion for improving healthcare. That's been the entire arc of my career. And I think Ochsner is really ideally suited to evolve care models in what's now proving to be a pretty transformational time in healthcare. So I was excited to join and help facilitate some of the innovation that's already been happening there for years.
And this was a shift for you, right? You're a clinician, but had been at Wolters Kluwer previously.
Yes, I practiced medicine for about 4 years, and then I decided to make a leap and join a startup in 1996, actually called UpToDate. Never expected that my career would go the direction that it did when I went to medical school. But I think sometimes we have to be a bit opportunistic and take some chances. And I've been fortunate that many of those chances have worked out.
And what has been your experience as a woman in the C-suite? And what would your advice be to others who are working their way towards similar positions?
It was a very interesting road to get here. I have to say I've been pretty fortunate in my career. I've had some female mentors, which I think is very important. Some of them were willing to take a chance on me, and served as great role models. I think early in my career, I would say that one of the most challenging elements of this was building a career as a woman having children. I had my first daughter when I was a medical resident. I was very fortunate that my husband was willing and able to take a year out of his training to stay home with her so that I could finish my training. Of course, I felt guilty about leaving her and going back to work, but that was just the first of many years of guilt that comes with being a working mother. When I had my third daughter, it got very interesting. I was 2 years into my time at UpToDate, which was just a startup then. I was told I would get no maternity leave. I could take some time off, but it would be unpaid. And I kind of understood the financials. It was a startup, money was tight, but I was kind of emotionally hurt because it was a business that I really given my heart and soul to for a couple of years, along with my colleagues. I had actually intended to work during my maternity leave because we had some important projects, and as a startup, it's all hands on deck. And then, I learned that the business wasn't going to support me, which was unfortunate. So the story had a happy ending, and I think a lesson that went along with it. I'd continued doing work from home after my daughter was born, even though I wasn't going to be paid for it. It was the right thing to do to support my colleagues. And then about 4 weeks into my leave, I got a call from our CEO who said, "I hear you've been doing a lot of work while you were out. I just wanted to say thank you and let you know we'll pay you for a full 8-week leave." And we got our project out on time. I not only continued to get paid, but I was also able to spend some extended time with my daughter working from home. And then after that, there was a full maternity policy put in place for the future. And I think the lesson it taught me at that time was to always just try to do the right thing. Doesn't always work out, but most of the time it does. And so that's, I think, having children and working is a big challenge for women. I think kids turn out to be more resilient than you think they are. And I think, again, sticking with the right thing usually serves you well. I think as far as getting to the C-suite, I'm convinced that opportunity came primarily because when we sold the business, we had a female CEO who was willing to take a chance on me. We'd talked to several other potential acquirers, all either male-dominated private equity companies or other strategic businesses with male CEOs, and all of them were going to bring in an outside male CEO to run our business. And the only exception was our eventual acquirer. And I'm to this day grateful that their CEO took a chance on me and asked me to run our business, because my career really took off from there.
And how's the transition been from being that top leader to being part of the C-suite as a chief digital officer?
Yeah, I mean, it's different for sure, but I think it took a really special circumstance, which is just the leadership team at Ochsner. So the CEO of Ochsner, Warner Thomas, is fantastic. Very supportive. Very much a type of leader who says, here's your job, go do it. Keep me informed. Let's stay aligned, but go do your job, which is, I think a real key to being an effective leader. So that's made it, that's made it much easier. And then just really a supportive executive team overall, and really a business that's been very hungry to hear new ideas and to execute on those ideas. So I probably couldn't have landed in a better situation, honestly.
And how is Ochsner trying to improve diversity, equity, and inclusion in its ranks?
Yeah, so it's a major focus for the health system, and we hired our first chief diversity officer, I believe, a little over or maybe right around the time that the pandemic started, so maybe about 2 years ago. I'm definitely joining other women on the executive team. I'm not needing to break any ground there, and we have a lot of discussion about diversity overall. Ochsner is also a big supporter of mentorship efforts for women who aren't in leadership positions. And if I'm not wrong, I believe we were the first health system to establish an office of professional well-being. We run a lot of programs through that office to make sure that all of the staff feel supported and empowered in the workplace.
That's wonderful. And I want to focus also on your work in digital health and the work of the health system. Can you tell me a bit about the digital health strategy and what are you doing different than other providers?
Ochsner was really ahead of its time in developing tools to remotely monitor patients with chronic diseases so that they stay more connected to the health system and achieve better outcomes. And that's what got my attention. They started a group called Innovation Ochsner 2015. So before most health systems were thinking about these things, with the goal of trying to use digital tools to evolve care models and improve the quality of care and the patient experience. We've employed these tools now with patients in all different demographics. We've been able to improve on the management of diseases like diabetes and hypertension, even in patients who could never achieve control prior to beginning those programs. And we continue to innovate. We have a program called Connected Mom that uses digital tools to help better manage pregnancy from home. And we've incorporated advanced AI and predictive modeling to identify patients who are likely to deteriorate in the hospital so we can intervene early. So a common theme is, again, trying to disrupt ourselves a bit in these care models, because we know disruption is coming. And it's my belief and others that health systems should be the disruptors versus having others tell us how medicine should be practiced. It's a major reason why I wanted to come here. I really feel fortunate that I found a place at Ochsner that's willing to take a risk and be a leader in that disruption.
And there are so many disruptors and so many new companies that are coming into this field and trying to tackle the problems in healthcare. How much of this are you guys doing in-house versus working with some of those startups?
Yeah, it's really a combination. So we've certainly started with the mentality of we can build a lot of these tools ourselves, and frankly, we have very capable teams that it's true. I think what we're beginning to realize is yes, we can build all of these things ourselves, but there might be faster paths to market, and we might be able to do things sooner if we have more partnerships. So we're beginning to look at those, beginning to develop those. We have a pretty active arm of the business that's looking at venture type of investing and looking at early stage companies to find those that might fit within the mission and the strategy of what we're trying to achieve. So I think we'll probably be doing more partnerships moving forward, and that's a good thing. And I think we really need to consider both.
And you have admirable connections with your patients, especially through those innovations that you mentioned, and also like the OBAR. How has that helped the health system's digital health work?
Well, it's all about the patients. I mean, patients are in the center of everything that we do. The OBAR is a place where patients who are involved in our digital programs can go and have support for their devices, figuring out how to use them, figuring out how to connect them to their phones, how to make sure everything's working properly. And I think that reflects a bit of how we've thought about health equity as well, because we're very cognizant that not everyone has access to all the digital tools that are available, and even when they have access, not everyone knows how to use them. We've done some work trying to understand, as an example, just barriers to digital equity in older patients, and we're beginning to address those. And I think it's very much part of our mission to make sure that all patients have access to what they to across the board to what they need, so that we can take the best care of them. So it really comes from the top of the organization and our strategy to always put patients in the center.
And how are you putting your stamp on Ochsner's digital health initiatives?
Well, it's early, so I'm still onboarding. I'm having a lot of conversations with clinical leadership, trying to understand what the needs are, trying to understand what the barriers to adoption of some clinical programs may be, because there's a lot of change management. Ochsner's just celebrated its 80th anniversary, so there's a long history of success there that we're not going to come in and change overnight, nor do we need to or should we. So I think it's about connecting with people as much as I can to understand where they're coming from, to see what challenges we can begin to solve, and to really get deep into the data to really understand not only what we've done, but just make sure we're all very clear on the impact, so that we know where we want to step on the gas, where we may want to hold up a little bit. So that's a work in progress at the moment, and so still trying to set some priorities. But again, I'm coming into a lot of good work that's been done, so it's not a matter of starting from scratch. Fortunately, it's a matter of trying to tweak some things and to make sure we're best organized for success.
Well, thank you so much for joining me.
Thank you. This has been great. Appreciate it.
And thank you for watching the checkup.